right, I'm entering the room and washing my hands. Hi, Mr. Hoffman. My name's Nancy. I'm going to be your nurse this afternoon, and we're going to be doing an assessment of your respiratory system. Is that okay?
That's fine.
All right. I want to start out with 2 questions. Do you smoke cigarettes?
No.
And have you ever smoked?
No.
Do you have any history of lung problems like asthma, emphysema, bronchitis?
I have none.
Okay, all right, good. So I'm going to proceed with the assessment. First thing that I'm going to do is I'm just going to be observing and looking at the chest, and this is the inspection. So I'm first noting his respiratory rate is within normal limits. That's how fast he's breathing, and the rhythm is regular, meaning it's a nice, normal, regular pattern. I see your respirations are deep. I do not see any retractions or bulging of the interspaces. I see you're sitting up straight as opposed to leaning over, trying to catch your breath. And I see that the chest is symmetric. I also notice that the anterior-posterior ratio to the transverse ratio is 2 to 1, which is normal. Then I'm going to continue my inspection, also looking posteriorly at the posterior chest. Same thing, looking for any abnormalities for the shape of the chest, which is within normal limits. The chest should be shaped like a cone. All right, then I'm going to continue the assessment by palpating the chest. I'm going to touch you, and I'm going to touch the chest all over. Please let me know if you have any tenderness or pain in any areas. And lift up here. And I'm checking for anything abnormal, bumps, bruises, masses, pain, tenderness. I'm looking at the skin for anything abnormal. I'm looking at the color of the skin while I'm doing this, particularly looking for pallor, okay, pale, or cyanosis, which would be blue. And then can you stand up for me for just a second and turn around? And I'm going to check the expansion of the chest by putting my thumbs right here. And then can you take a big breath in and out? Okay, and you see my hands move in and out. Do that one more time. In and out. Good. And so the chest expands symmetrically. Have a seat again. And then I'm going to continue with my assessment by auscultating lung sounds. So I start auscultation at the trachea. And then I want you to open your mouth and breathe a little bit deeper than normal, in and out. Not too deep, just a little bit deeper than normal. Good. And then I'm going to continue listening. I listen to a full breath in each spot. And I compare side to side as I go down the chest. Good. Are you okay? Feeling lightheaded or anything?
I feel fine.
Okay, so just breathe normal for a second. Even on a female patient, you're going to listen in this pattern, okay, around here, and then you can lift up to listen down low. So you can listen above the bra here and below the bra across here. And then I'm going to listen on each side. So left lateral, can you lift your arm up? Listen in 2 places, big breath. And again. All right, and can you stand up for me? Let's turn this way, and that way. And then on right laterally, we're gonna listen in 3 spots. Big breath, big breath. So on the right, there's 3 lobes, so you listen in 3 places. 1, 2, 3, like a triangle. And then posterior, we're going to listen, starting at the very top. The APCs of the lungs come way up here. A big breath. Open your mouth and breathe in and out through your mouth. I compare side to side. And I'm going around the scapula. One more. Okay, good. Have a seat. So over the trachea, I heard bronchial breath sounds. Over this area, the center near the sternum, and also in the back, in the upper area, I heard bronchovesicular breath sounds. And all the periphery out here, and posterior, and all the periphery, I hear vesicular breath sounds. All right, so that concludes our assessment of the thorax and lungs.